right, good morning, everyone. Welcome to the first spring virtual field trip for the Institute for Health Innovation. My name is Carolyn. Carolyn No. I work for the Institute for Health Innovation at Northern Kentucky University. What we do is work on community health. We do all sorts of programming from interventions for substance use disorder in Owen County to programs like this where we encourage students to have an interest in health careers. Today, I am joined by Dr. Terrance Anderson from the College of Health and Human Services. He is going to be launching our first occupational therapy program here at NKU. I have a list of questions that I'll be asking him, and we'll kind of run through those pretty quickly just to get a sense of some really basic questions about what is occupational therapy, what is it like to be doing that as a profession, and then after that you all will have an opportunity to ask questions, and we'll kind of go from there. So are you ready?
Yep, I'm ready.
Excellent. All right, so our first question is, what is occupational therapy?
That is a great question. I get that often. I did not myself know what occupational therapy was until I had finished my bachelor's degree. So occupational therapy is a healthcare profession. We're allied health, and we help people become independent or gain a higher level of independence in doing activities that are important for them every day. And we call those occupations. So that's why it's occupational therapy. We're not career counselors. We help people with whatever tasks they may be struggling with due to an illness, injury. Everything from a person who has a stroke and now has the use of one hand. How are they going to cook a pot of spaghetti and get it over the sink and drain it? How are they going to button a shirt or zip up a jacket or tie their shoes? To some of the psychosocial issues. I've worked with clients where they got fired every 8 months. They couldn't figure out what the problem was. So I was able to work with them to help identify and then make plans for change so they can be independent. And so we as occupational therapists, we help analyze or evaluate what's going on, what are the problem areas in a person's life where they're not as independent as they want to be or need to be. And then we help intervene. And that intervene or that change can be anything from rebuilding skills that they've lost. Okay, muscle got too weak, joint got too tight. So really working on that basic, regaining that skill. Or it can be changing the environment. They can't reach over their head anymore because of injuries. So in the kitchen, moving things out of the top cabinets down to the low cabinets on the counter. So then we've changed the environment. So then they can be independent and do their own cooking. And then we can modify the task. They're not able to open cans, the two-handled can openers. So we, instead of buying canned food, they get frozen food. So therefore we've modified the task that they're doing because it's using a microwave and it's opening a plastic bag versus a can. So we help in all areas, people from birth to the end of life.
That's so exciting.
Yeah.
So it sounds like occupational therapy has a really unique role in healthcare and wellness. How would you describe that? How it relates to some of the other things that that folks might experience in the healthcare field?
Yeah, so we're uniquely trained on what we call task analysis. And that's coming in and looking what needs to be done and every skill that a person needs to do it. So everything from cognitive skills, such as remembering organizing, sequencing, to motor skills of balancing, reaching, grasping, to social skills as far as zipping it when it needs to be zipped and speaking up when you need to speak up, reading the environment. So looking at basically a basic job of a waitress or a waiter. That's one of the more complex demand jobs, even though it's very common, because you have to have high energy, high endurance, really good navigation skills and sequencing. So you've got 8 things to drop off to 7 different tables. How are you going to sequence that so you're not going back and forth? How are you going to manage your own emotions as you have the very nice customer who's almost too nice and wants your phone number, to the very grumpy customer? So then you have to, use those skills to monitor and manage your own responses and being intentional in your responses, to just the memory skills. Okay, this table wants that. This one needs that. All different items. And then there's the counting of the bill and making sure that's accurate. So very, very complex, and all that's done. So we are extensively trained on how to analyze everything that needs to be done, and then also how to assess and analyze what skills a person has. So, I'd make a horrible waiter. And when we look at my skills and my abilities, that memory on the fly, it's just not there. So table 8 would be waiting for the ketchup for 20 minutes, and I would get no tip. Because that's not one of my strengths. It was an area I'd have to really work on if I were a waiter at this point in my life. So it's really then analyzing the person's ability, where they're at in all areas of their, and then the demands of the task that's being done, and then helping mediate the difference. Whether it's, again, changing the task, helping the person to grow in areas, changing the environment, so then the person can do it independently.
That's great. I think you've really well described what occupational therapy does. I do think that a lot of people think occupational therapy, physical therapy. So what are the differences between those two fields?
Great question. It used to be not very clear between our two professions. I can remember when I was being trained in the 90s, that was a big question. We were really looking at it, because we do have a lot of overlap. And it's really our paradigms. When we look at a person and what we're going to do, physical therapists, they want people to be independent, and so do occupational therapists. Physical therapists' focus is very much on the physical movement, helping them with the physical strength, endurance, and movement so they can be independent. Occupational therapists were much broader. We're looking at all areas of function that a person has and helping them in any one of those areas. So yes, we do physical because almost everything we do involves a physical component, but that's a very small component. There's all the cognitive, the motor control, the environmental adaptation skills, social skills, all of that are involved.
Great. And you've described a really broad field in occupational therapy. Are there specializations within occupational therapy?
Well, yes, there are. But first, I want to go over our actual area of practices identified. So right now, these are changing and growing as we're a dynamic profession. So the areas of common areas of practice are children and youth. So that can be anything from like an early intervention. Infants who are born premature often need extra care in that first 2 to 3 years of life to meet the normal development milestones, and we're there to help that. To school systems, any student who really struggles to participate in their educational environment, we can come in and help them do that. So really that, and then in addition to children and youth, we do health and wellness, and we do medical, we do outpatient, we do inpatient or acute care. We also do community-based, and community-based is where we're going out and more of a programming for the whole community, especially when we look at health and wellness. Bullying prevention is a big area that we work on. And we also have mental health, and that can be everywhere from inpatient, people who are having an inpatient stay, to those who go to a day program, to those who just need assistance being independent. Productive aging, so really looking at helping the more experienced people in life as they transition. And we're finding most people want to be independent in their own homes or own apartments as long as possible. So we are uniquely skilled to help make all those many modifications and changes, so they can be independent, and live independently as long as possible. We also work with visual impairment. That's a new area, an area we're growing in. When you're talking about low vision, there's many modifications to the environment that can be made, and then we're really skilled in that area too. So those are some of the common areas. Some of the specialties, there's something called there's hand therapy. So a certified hand therapist is either an occupational therapist or a physical therapist who gets extensive training and an advanced certification on hand injuries, shoulder injuries, and how to treat them. There are those, you can get training in any area, advanced certification in any area of practice. They're being developed. So you can have a school system, you can get a geriatric. So those are some of the areas. When I find one of the most interesting areas actually work in industry. I had a student who worked for Bobcat Manufacturing, and she analyzed every single task of every job in the entire manufacturing warehouse, and everything on how much weight needs to be done, which muscles are involved, what cognitive process needs to be done, and she helps streamline the whole process. And when a worker is injured and then is on limitations, then they can find a job they can do and still be within their doctor restrictions.
Wow, that's really cool.
Yeah.
I can imagine, especially in jobs like manufacturing where there's so many different things going on, and especially like a physical piece to it. Unlike us, desk workers, you have to be able to type. So, that's just one kind of adaptation that would have to happen. So you talked a little bit about this already, but where are some other cool places that occupational therapists work?
Let's see. There are so many. Really, we can work in any area. Some of the unique ones I've heard of is actually working with city governments, where with the planning, sidewalks, crosswalks, accessibility, universal accessibility. So I remember back when water fountains were there wasn't much diverse, and if you were in a wheelchair, you couldn't access a water fountain in public places. So then they made them lower and coming out. And then I had a friend who was 6'8" and had low back pain, so he could not bend forward. So when he went out, he could not use a water fountain because he was too tall. And so when we work with universal design, you're now seeing, there's 3 water fountains at 3 different heights. And so that's to make it as accessible to as many people as possible. So that's one of the areas where I really find it exciting that occupational therapists are getting involved in really helping plan the whole community. And that also not only physical access, but creating spaces for balance, when you're really, really stressed at school and you got all those assignments, being able to go out and either play a game of racquetball or go for a walk in the park or, go to a library or a coffee shop and chill with some friends. Creating those spaces is really important for people in that life balance. And as occupational therapists, we see that's very important to have the environment set up so people can get that stress management opportunities there.
That's really cool. So switching gears a little bit, how did you become an occupational therapist?
Good question. Again, I had finished a bachelor's degree in counseling psychology and had never heard the word occupational therapist. So I actually was in a pretty severe car accident, and I got physical therapy and chiropractic care and some occupational therapy. So that's where I was exposed to it. Excuse me. And the occupational therapy was just a consult. So I really didn't understand what occupational therapists do at that point, because I was much more focused on my physical injuries. But I ended up, it was my senior year of college, my last semester. So I ended up getting some incompletes and finishing a little bit later. So that's where there were struggles with just getting everything done and organized with all my medical appointments. So I did my clinicals for my counseling psychology and realized it wasn't the right fit for me. It's a great field, but I couldn't just sit in an office all day. And so I really saw the importance of being active and helping clients get active and outside of their talking zone to an active zone. I grew up very rural, and so we did most of our stuff ourselves. And I've always understood the good feeling after you've cut a cord of firewood and stacked it. You feel good about what you've done. You can see that accomplishment. So then I started looking. I looked into chiropractic care and figured, not quite right. I was looking into physical therapy, and as I was checking out programs, I came across occupational therapy, and I'm like, what is that? So then when I read, it's about helping people. It's about being a problem solver. We are problem solvers for people's life so they can be independent. I thought that was a perfect match for me, my values, my personality. So the first time I read what an occupational therapist was, I knew that's what was for me. So then I went and I got my master's in occupational therapy, and I loved every day of practice.
Yeah, we talk a lot about in these sessions, like how important it is to find out like what you don't like as much as it is that what you do like. And so college is such a great opportunity to do that because you have so many different classes you get to take and try out. And then things like clinicals, especially in the health field, you get to really see what it's going to be like.
Yeah. And that's where if my clinicals had been earlier in the program, I would have realized sooner that I personally needed something more active in my daily life.
So what was your educational experience like once you figured out you were interested in occupational therapy? What did that program look like?
Since I already had a bachelor's degree, I did an accelerated master's. And so I did 3.5 years of school in about 2.5. So that's how the program was designed, because they figured it was for most people. By then they figured out what they want and they're just driven. So it was very challenging because I went from working a full-time job. I cut back to about half-time and then tried to go to school full-time. And so it was a big adjustment for me. So I loved everything I learned in the classroom, but I got tired a lot because I was just doing so much. I had to pay, I paid for everything myself. So that really did create a stressful schedule. So it was mixed. My experience was very mixed. I loved what I was learning, and I loved being an occupational therapist, and it was very interesting, intriguing. But then it was, when we talk about life balance, I was struggling with life balance, at the time. So that was my master's, and I did very well. Very happy with the education I got. And then actually 2 years after I graduated, I started teaching, which was a rarity. It's 3 years. I apologize, 3 years. 2 years of practice, and then the beginning of the third year is when I started teaching part-time. And then by my fourth year out of school, I was full-time faculty. So love teaching it, love doing it. But I've also are much more in tune to students and their busy schedules. So that's why the NKU program is being designed to be same amount of credit hours, but just stretch it out and versus cramming it all in. So students can have a better balance of life.
That's great. I was actually going to ask, since you are designing the program, essentially what changes you were going to make. And then I also know, I've heard that occupational therapy is changing from a master's degree to a required doctorate. Is that correct?
Well, sort of. Okay. The profession's having discussions. So part of the field is very committed to entry level. To get a license as an occupational therapist, you have to have a doctorate degree. Part of the professions is we don't want to put so much education dollars, expenses to students when they graduate. It's going to take them longer to pay off their debt. So we've got these two camps, and it really comes down to what is needed to practice. And we're seeing in many areas, if you're working hospital setting, acute care, those sort of things, the doctorate has a lot of advantages because there's so much you need to know. So patients don't die because you don't catch their AFibs going on. So there's so much training. The volume of knowledge that needs to get into a student takes years and years. So I personally believe that if students are going to do the amount of work for a doctorate, they should get a doctorate. When you look at many of the master's programs, you look at the number of credit hours a student does from freshman year in college to degree completion. That number of credits in many of the master programs is enough credit hours to be a doctorate. So that's where I just being just that if we're the program we've designed at NKU, I think is just for our setup, where they're going to do that many credit hours, so therefore they're going to get the doctoral degree. Now there are some master's programs that are great fits and do have a very reasonable workload, where students are starting in their sophomore or junior year. And taking some of the occupational therapy classes. So it's a blended bachelor's, master's, and then those have a very reasonable workload, and are very just. So shopping is important for a program.
That's great. It's always interesting to hear what's going on in everyone's industries. Things are always changing.
Mm-hmm. So the regulation now is it can be master's or doctorate.
Okay.
And the university gets to choose which one they're going to offer, and there's different standards. I also want to clarify, we didn't go over an occupational therapy assistant.
Okay.
That is an associate degree or a bachelor's degree. And the assistant does just the delivery of intervention and can help with some of the assessment. The occupational therapist has the whole process, from assessing a client, determining what the goals are, what interventions are appropriate, delivering the interventions, and then following up with quality control. So just wanted to
Yeah, that's
Correct.
actually a great transition because we've talked about who occupational therapists work with in terms of patients, but we haven't necessarily talked about who they work with in terms of other staff or other
Mhm.
care providers. So do you want to talk a little bit about that?
Sure, we are very much into the collaboration and the interprofessional interprofessional collaboration also. So depending on the setting, since we're working with people's lives and their ability to be independent, um, most settings we work extensively with other healthcare professionals. We work with the client, we work with the caretakers of the client. Um, so in a school system, it'd be the student, the parents, teachers, all the teachers, speech therapist, physical therapist, social worker, case manager, um, you know, yeah, and any of the teachers. Um, and sometimes they have aides also that would be working with. In acute care setting, you're working with the physician, the nurses, the physical therapists, the speech therapists, the case managers, respiratory therapists. Pretty much any professional you see, maybe even dietary as we're dealing with some of the food and, swallowing issues and all that.
That's great because we've had some respiratory therapists, we've had some nurses, we've even had someone come and talk about dietary needs.
Hmm.
This is kind of tying all of that together.
Awesome.
So what do you think are some skills that someone might need in order to be a successful occupational therapist?
Um, Well, as occupational therapists, we believe people can grow, so you don't have to be excellent. But some of the skills that you're going to use a lot um, is really your people interaction skills. Um, and that's when I had to grow in. I was pretty quiet and pretty shy. And I believe I make a great occupational therapist. I was able to grow in that area. So as I go over some of these, some of them you need to have, and some of them you just need the potential. So really, the full people skills, problem solver, and as a problem solver, you need to be very observant, and then think of many options of how things could fit together, and then have flexibility to realize, you know what, there's 20 different ways this would fit together, and none of them are wrong. Which one is the best fit for this person at this time? And so to have that flexibility, oh, we tried this, and it didn't work quite right. Let's modify and move on versus getting stuck. Oh, we didn't do it right the first time, so it's a major crisis. We are very creative. It goes with that flexibility. So it's really getting the clients to engage and motivating them, because often when they're in a major illness, it's easy to get down and discouraged, and so really to have that cheerleader component to really encourage. Um, so those are you need to have some science skills, because you need to understand the physics. You need to understand anatomy. You need to understand different diseases and the processes and how they impact function. Um, Really an independent spirit. I understand I want to do things myself. I want to, I want to mow my own lawn. um, yeah, I could hire someone to do it, but that's something I enjoy doing, something I want to do. And so to understand that, oh yeah, I had a farmer, she had always gotten out, always slept on the same side of the bed for 48 years, due to a hip replacement, recommending she get in and out of the other side of the bed because it'd be easier for her physically. But that transition from one side of the bed to the other was just more than she could handle. So then being flexible and saying, you know what, this is our recommendation. I understand this is what you need for your organized life to keep something in place. So then working with her, changing me flexibility and me changing, and then working with her on how to best manage where she could adapt to.
That's awesome. I mean, I think we all have things in our lives that we do that we don't want to change, and maybe it'd be easier, but it just works with our life flow. So
Yes.
makes sense.
Absolutely. So if a student is coming in and they're very rigid, it's always this way, and then I'd want to, is that rigidity just organized and they can adapt and adjust, or is it rigid?
Mm-hmm.
If it's truly rigid, then occupational therapy may not be the best fit for them.
Right. That makes sense. So final question, what are some common challenges that occupational therapists face in their workday or their career?
Documentation and reimbursement. Definitely the hardest. The rules are constantly changing. Your notes are always getting audited. There's always a risk of a lawsuit, so you do need to have very clear, very accurate documentation. So I think that across the board is what most therapists think is the most challenging part. Then the other components, you can have challenging clients, but you also have it's one of the least stressful jobs. It's ranked one of the 10 least stressful jobs. But that seems kind of crazy because you're dealing with people in all kinds of illness and grumpiness and stress, trying to see so many clients and so many floors in the hospital. And it comes down to it's very rewarding, and that's what creates it as low stress. When you have those clients who make the progress, who are now going home and living in the home they've lived in for 48 years, and they're so happy they get to go home versus an independent living center or a nursing home. That is very, very rewarding. And so that's one of the greatest parts of being an occupational therapist, and the most rewarding is seeing your clients enjoy their life more because they are more independent, because you've helped them get there.
Well, that's a really great optimistic note to end on. So students, if you have questions, you can start typing them in the chat, or you're welcome to unmute yourself. And we'll give you a little bit of time if you're typing. We know that takes a little bit of more time than unmuting, but now is your chance to ask those questions. I always feel like we need background music,
Mm-hmm. So while they're thinking, I can go over a few numbers as you're thinking of your
Sure,
question.
yeah.
Because if anyone's considering occupational therapy, you always want to know how much is it going to cost? Am I going to make enough? So right now, the mean or the middle salary for occupational therapists is about $41 an hour, which would be about $86,000. So depending on your region, some pay better than others region. So you really got to check your individual state and city, but that's about what occupational therapists make.
That's really good. We have a backup activity for in case someone ever has to cancel during one of our field trips, and one of the things we go over is what you want your lifestyle to look like,
Mm-hmm.
how much that's going to cost, and then what jobs actually sort of meet that salary requirement. And so it's kind of a fun activity because you get to see all right, I'm already interested in healthcare, or maybe I'm not, but you can see how much you can make.
Another great positive on occupational therapy is once you're licensed, if 5, 7, 8 years down the road, you get really bored in your job, you can completely change what your day-to-day work is without getting a new license or going back to school. I've had graduate students who have graduated and they did hospital setting. And they loved it. Very dynamic, very fast paced, and busy, and seeing a bunch of patients and all that. And then, after 10 years, they're kind of tired of it.
Yeah.
And so then they go and they maybe go work for a school system. And so as a school system, you're on the school schedule. So you have those breaks, you have those holidays, you have summers off. You can leave work many times at 3 o'clock when school gets out, and do your documentation on your home computer instead of at the building. Very different pace, very different setting. Or they can go into hand therapy, which is, a very, very focused, setting, and very different, very dynamic of working in industry or going into teaching, academia. So, many people will make major changes in their career in the 40 plus years they're going to work after college. Occupational therapy can give you lots of opportunities for a lot of diversity with utilizing that degree.
Yeah, I have a friend who's an occupational therapist, and she did travel occupational therapy, which was really cool. She was always in like some new town. She lived in Texas and in Georgia, somewhere else, I can't remember, but she really enjoyed that.
Yes, absolutely. That's one of my retirement gigs. I figure once I retire, you typically travel appointments are 3 months at a time. So I figured, well, if I can do 3 months on, 3 months off, be able to manage that, and then you get to go. They provide apartments, housing, wherever they send you. So a great way to explore the U.S.
Yeah, she really enjoyed that. The other thing she's doing is she now works for the Emory medical system, and she's been doing some research projects. And so I don't know if that's something that, for students who are both interested in sort of the hands-on and in the theory, what are some opportunities right now in research?
A lot, because as healthcare providers, we have to be evidence-based.
Yeah.
That is just mandated in our culture, and it's good. And really looking at what is evidence-based. It's the best available evidence that's out there. So we started without any evidence as a new profession 105 years-ish ago. And there wasn't evidence behind it, but it was common sense. It was just common knowledge. As a person is recovering in the hospital, if you're sitting and doing nothing, the muscles aren't getting used, the organs aren't getting used as much because they're just sitting and gets more depressed and less functional. Saw soldiers who were up helping clean, sweep because they were just stir crazy.
Yeah.
And they got better. Those who were stir crazy and did things that were purposeful and meaning got better. So that was the beginning of our profession, and research started then 100 years ago on what it means for people to be able to be productive and independent. And so now that we're very clear on what our scope of practice is, and that the focus is for people to be independent and have higher level of functions, there's so much research that needs to be out there as far as methodology, techniques, values, importance to the person, and how to get that done, where we can continue to get reimbursement because it is a valuable service.
Awesome. Students, do you have any final questions? We'll leave it open for a little bit. I see there's one comment that someone was really interested in learning the difference between physical and occupational therapy. I think, when my friend first went into occupational therapy, I certainly didn't really know the difference, but I knew she was excited about it.
Yes. And that's where they're both great careers, and it's which is the better fit for the personality, because we're pretty close in pay, we're pretty close in some of the medical settings, and I think occupational therapy is more creative in working with a client, how you're going to do that. Physical therapy has some great protocols and really following what's the best protocol for this type of injury, and really being creative and encouraging the client to really follow that protocol and recover really well. And so occupational therapy has a bit more creativity as far as it's not a set protocol. I've got all these options, all these tools to help them, which is the best set for this particular patient.
That's great.
Mhm.
Well, unless there are other questions, I really want to thank you for your time. And I'm excited that we got to spotlight a new program at NKU. It's just, I'm really excited that we're getting so many more new, awesome, cool things here. And I know you're probably going to use the simulation center quite a bit.
Oh, yes.
The students last semester got to see a nice little tour. Rami took them around on a little cart and videotape. So they're aware of like how awesome that space is. So NKU is a great place to come if you're thinking about a health career.
Yes, absolutely. Wonderful facilities and great faculty.
Well, you're getting a lot of thank yous in the comments. If anyone does have follow-up questions, the folks who signed you up for this program can obviously reach out to me, and I'm happy to connect you to folks on campus if you have more questions about the occupational therapy program or just our College of Health and Human Services in general. I will preview our next program. Let me pull that up really quickly here. So our next event is our hot topic, and we have someone who's going to talk about vaccine research and the new COVID vaccines, which I know is very cutting edge and exciting for folks. I know we're all anticipating getting our vaccines. So I look forward to seeing everyone on February 3rd.
Great.
All right.
Awesome.
Have a
Thank
good rest
you for
of your day.
joining today.
All righty. Bye.
Bye.